We welcome you all to Talk the Talk. My name is Janine Stiene,
And I'm Toni-Ann Antoniato.
the Masters of Myofunctional Therapy.
Together, we interview physicians, dentists, and other professionals to learn how their expertise can benefit you, your child, or your patient's speech and language skills and complement the services they are receiving. We welcome you all to this episode of Talk the Talk. Joining us today is Anders, the CEO and founder of REMastered Sleep. Anders is a passionate medical innovator and created the Remplenish MYO nozzle straw, which we know and love in our practice. Thank you, Anders, for joining us today.
Yeah, thanks for having me.
No, we absolutely are grateful. Thank you so much. So just starting our Talk the Talk out, I think it would be very interesting to hear and for you to tell people your story, how you came about inventing such an innovative tool to support airway health, muscle strength, better breathing, better sleeping, and so much more. Can you tell us a little bit about your story and how Remplenish came to be?
Yeah, I always got to decide how long of the story I should do. So, yeah, so
The version you like.
The version you like, exactly.
well, we'll just go and see where it goes. So,
Okay.
yeah, my background is in biomedical engineering. So, actually, kind of how I got into this, I used to work at Medtronic on implantable drug infusion pumps. I did a master's of science in medical device innovation. So, it's during this program, we're going to different like sleep study clinics and witnessed a severe obstructive sleep apnea patient just outright refuse CPAP therapy. So, and even the family was there begging him. They're like, please, we know how important this is for your health. And the person just wouldn't use a CPAP, so the mask and hose to keep the airway open at night. So that was like the big eye-opening moment for me. And so, after that, kind of dug into, what's going on here. And 80% of, cases are undiagnosed. So a lot of people just they might know they have the issue, but they don't want to know. There isn't really like a good outcome to the journey. But CPAP's an awesome tool when used, but a lot of people don't necessarily want to have to use it and look like Darth Vader. And then you have like the 20 to 50% outright refusal rate of CPAP, and then a 50 to 60% compliance rate. So it's kind of after seeing this, I was like, okay, I feel like I have to do something about this, and dug into the research, and we came across this didgeridoo study where playing the didgeridoo, so it's the long Australian Aboriginal instrument where you
Right.
kind of go the brrr. I didn't bring one here, otherwise I could try and play it for you. But but doing that, there's a study in Switzerland where they showed reduction in obstructive sleep apnea. So that was kind of like the big, okay, like what's going on here? This is different than traditional therapies, treatments such as like CPAP or mandibular advancement device or Inspire is kind of like in my mind a little similar but different, it's stimulating to keep the airway. So there's like this nugget of okay, what's going on? So then we go and we come across the studies in University of Sao Paulo in Brazil where they're doing target exercises or, myofunctional therapy and they showed, reductions by 50%. And maybe I'm mixing some studies together, but 50% or greater for mild to moderate obstructive sleep apnea and snoring. So for us, it's like, okay, this is cool. Why haven't more people heard of this or why aren't they talking about it? So we started interviewing people that snored and had obstructive sleep apnea. We're like, hey, there's these exercises you can do. Like, what do you think? And a lot of them, a lot of people are like, yeah, I don't work out my normal body enough, like, let alone trying to do this daily therapy, it's a lot of burden for me. So that's kind of where I was like, okay, so we kind of took the exercises. And actually at the time I was traveling the world, studying like in Asia and Africa, studying health needs for 9 months. So after that kind of broke down the exercises, like, what do we think's going on? And then we had a therapy. So we're like, okay, we have a therapy, but how do we deliver it? So really it was about and talking with myofunctional therapists, speech language pathologists, like the tricky part is getting, and I'm sure you both know, but getting people to follow through and do the exercises and do it correctly. So that's where like, okay, we're brainstorming. We have these like crazy ideas. One of them was like a celery ball, like you got to get like some wild stuff out there. But but we're trying to come up with this thing, and really it was watching Comet the dog eat peanut butter out of a peanut butter Kong. So it's this like, little toy thing, or it's like you put peanut butter in to entertain them and stuff, and it's doing this exercise, and not even realizing it that she was doing the exercise. So that was kind of the big like light bulb moment of, okay, well, what if we embed this into biologically driven action, such as drinking water? So that was kind of like how it came about, and yeah, and then that was we launched the product in 2020, so it's been it's almost our 5 year anniversary coming up on January
Wow,
2nd. So
That's
yeah, it's been an
amazing.
awesome ride, and that's kind of yeah, kind of the beginning story, I guess.
that's awesome. How would you describe the straw as working? So, for anyone who hasn't heard the straw, heard about it, what makes it different than just drinking from a regular straw?
Yeah, so kind of like oh, I don't know if you can see it with the blur or not, but like
Yeah.
kind of drinking like a normal straw, you're kind of more pursing your lips, you're using your tongue in kind of like a backwards position where this you're actually using kind of the exercise we're trying to incorporate is like tongue suction, so kind of having tongue suction and then getting the tongue up, so tongue elevation. We're trying to target two different things as well as increasing resistance and repetitions to build, kind of build up the muscle tone and endurance,
Mhm.
and get good tongue posture. So it's really about these like repetitions, and it makes it simple because as you're drinking, you're not if you don't use it correctly, it'll actually reduce the amount of water you're getting out of it. So kind of encourage as positive feedback to encourage you to do the exercises. If you try and drink it like a straw, you're just gonna struggle for way too long probably and get frustrated. But yeah, it's really about like having positive feedback and then providing the therapy with resistance. So it's kind of this upward, suction in, compression, swallow, and kind of this motion here. So we kind of call it tongue push-ups,
Mhm.
because it's kind of the repetitions that you're
Mhm.
doing. And yeah, and then also for at least for like a lip seal, you kind of have a light lip seal on it. It's a more like oval shape when you have it in your mouth. So you're not like pursing the lips, so you're not using your cheeks as much. So it's really trying to target the genioglossus and
Mhm.
trying to target, some of the pharyngeal dilator muscles, but really about that elevation. So kind of the elevation and, targeting the genioglossus is kind of, yeah. And then nasal breathing too. So by having good tongue posture, so as you're using it, you're getting your tongue up, you're breathing through your nose, and you're incorporating that habit of doing that. So it's kind of forcing you to nasal breathe while you're using it, as well as it's helping improve your tongue posture. So then after you're using it, you're still having that tongue. If you have good tongue posture, you're not
Mhm.
breathing out your mouth because, yeah, you can hear me. I don't know if you can hear me if I really try. I have my mouth open,
Yeah.
Hmm.
it's going through. So it's just, yeah, that's kind of the basics of how to use it. So it's pretty simple, but it took a lot of work to get it that
I'm
Yeah, a
sure.
lot of training.
simple.
Anders, can you ever see making one that fits to like a baby bottle?
That's a great question. We're always like looking for further improvements, whether like earlier, you can have a huge impact on a child's trajectory or an infant's trajectory. So yeah, we're always, further R&D. We launched our junior product last year in the fall. So kind of, in that we've seen some pretty cool results. Let me see. I think I dropped an accident. So like this is kind of I love this I don't know if you can see it. Yeah, my
Yeah.
blur
Yep.
is not like working too good. Uh,
Yeah. Oh, there we go. Yeah.
but really it's yeah. You can go on our website, remmasteredsleep.com, and go to healthcare professionals and case reports or case studies. But really it's this little 6-year-old boy. He used the product. He had very narrow palate. He wouldn't let anyone near his mouth. He and severe. I wish you could see the photo because it's like really clear on the thing. But then he's also not eating different foods. Like he's not able to eat different foods. He used Remplenish Junior, so he's working with an SLP, and they couldn't even take measurements before because he wouldn't let anyone. It was just difficult to do that.
Yep.
After after 3 months, he went home for the holidays. After 3 months, the SLP thought he would, degrade in their therapy, and he had all these like crazy improvements where he's now like letting people near his mouth. He's letting people, he's eating foods he would never eat before. His palate is noticeably changed. And
Mhm.
all he did was drink, for him, all he did was drink water out of a Replenish Junior MYO nozzle. So it's just a
Mhm.
crazy, like, I love that. And that's
Yeah.
just the impact of, what tongue posture can do
Right.
on oral growth and development. So really, the sooner you can do that, you can really change the trajectory of that. So that's some stuff we're studying right now, which
Mhm.
we're really excited about. And so, but
Yeah,
yeah,
that's
but
great.
but
I mean, it obviously aligns with everything we do from the Myo side of how much the mouth can change just by getting the tongue up there. What we do at Spa Pal obviously is all for tongue posture too. That's how we met, through Spa
Mhm.
Pal and through your company, but also the fact that it gives them something to do at home. That's the
Yeah.
best part from the therapist side, that it's like, okay, well, make sure you're doing it correctly in your sessions. And now all you have to do at home is drink through this straw. And that supports their compliance with that myofunctional program.
Well, and then just even thinking of the burden on like the parents, like having to do the exercises, like even for an adult doing the exercises, that's like tricky enough. But now you're a parent trying to get your kids to do the exercises, like,
Mhm.
it's tricky for sure. So having like devices that make it easy for parents and kids to do the therapies that'll benefit them, like it's a huge like opportunity. And for like what I love about like Spot Pal, like so ours is more focused on like the back of the tongue and it's kind of uses some instruction. We do have like sensory bumps to help with like tongue tip positioning, but really it's also like the kid kind of has to know what they're doing, Otherwise their tongue tip they could still use it like in a downward position. Like it's just gonna be the same as what they normally do. But
Mhm.
like for your guys' device, I really love that, it's really focusing on getting that tongue tip in the correct positioning. So I love like, combining, kind of the different like aspects, like getting that proper like swallowing and getting
Mhm.
rid of the tongue thrust and then practicing. Like ours is good for reinforcing
Mhm.
what habits that they're doing. So it's
Mhm.
like getting those repetitions is really important, but like getting that solid foundation first. And that's what a lot of myofunctional therapists, when they introduce our products, it's after that, in the swallowing phase, after you have your foundation. So I
Mhm.
think like, yeah, I think there's huge opportunities for like collaboration and to
Mhm.
really help a lot of people, and so.
Us- we feel the exact same way.
Mhm.
It really does. They really do complement each other so well. Can you explain just to like the lay person why using a straw like REMastered will Remplenish would help sleep apnea?
Yeah, so it's kind of a mixture of so it's going after there's like a third of obstructive sleep apnea patients, a primary cause of their obstructive sleep apnea is neuromuscular responsiveness. So there's different like phenotyping research that they're doing, and there's not really like what I'm trying to figure out is like how to like apply it into practice more. Like how do you identify those subjects or patients, and really but at least, yeah, a third of them are good candidates for it. So if you improve that neuromuscular responsiveness, it's going to have a huge impact on, their apnea events. So that's kind of where, it's kind of like the tongue, think of like when you're sleeping, the tongue is relaxing, it's falling back. You have kind of like the collapsibility of your airway. So like how easy is it to collapse? So if you think of like the negative pressures every time you breathe in. You can even, if you look in a mirror, you can see your genioglossus engage every time you breathe to try and prevent your airway from collapsing. And that's just like a response of your body. You can also see like gravity itself, like you're combating gravity, whether it's on your neck and, the circumference of your neck or it could be your abdomen as well. So it's what this is kind of trying to target. So the theories are one is like the tone. So you're trying to get like the muscles are less likely to maybe they'll still shut down while you're sleeping, but they're either going to respond better or maybe they won't collapse as easily. Another part is trying to strengthen the airway. So it's going after the collapsibility of the airway. Like can you by toning it, by changing, they've done, studies is more for like in rats and other things, but by doing exercises, you're changing the muscle fiber types. So kind of more fatigue resistant muscle fibers and I think I have to look at like I've heard this one, but I have to actually look at the research of this one is kind of like the endurance part. Like a lot of the people who are, having obstructive sleep apnea, it's just that they're trying to keep their airway open during the day, and they have strong muscles, but they don't have the endurance of the muscles. So then when they're at night, they're collapsing. And so really what it's trying to do is toning the muscles at the back of the throat to
Mhm.
help prevent them from collapsing as easily. Another part is getting good tongue posture. and nasal breathing at night. So just kind of having that relaxed jaw, you're kind of putting yourself in not of a strong as a position while you're sleeping. Um, and yeah, I think those are, I
Mhm.
think kind of the theories out there. Obviously, there's studies out there that show myofunctional therapy to reduce obstructive sleep apnea by 50% or greater. So like a 12 AHI drop, and that's significant, like,
Mhm.
especially for the moderate and mild. But yeah, like I don't know if they have like mechanisms fully understood, but other than it's toning the muscles.
Right.
And you can think of like what Inspire can do. Like Inspire is stimulating, it's just causing the tongue not to fall back. It just has a baseline, to prevent
Mhm.
it. Or if you start collapsing, it's, preventing you, it's kind of activating those muscles again. So it's like the muscles have a huge impact.
Mhm.
But on the flip side, like let's say your main cause is more, obesity related, like more weight, there is like other things, with the structure. So whether it's maybe you just have too much. So it depends on what your factor is. So you kind of have to think of like what your factors are. Or if your palate's too narrow and you can't fit your tongue in your mouth, like there's other factors, but
Mhm.
this is kind of going after the neuromuscular responsiveness. And then the theory is that by having good tongue posture, maybe you're affecting some of the space, the oral cavity space.
Mhm.
But yeah, there's a lot more research to be done for sure. But like,
Yeah,
but
always.
definitely but the end results are people are feeling better and
Mhm.
they're getting better sleep. So
Right.
I'm sure in however many years we'll know exactly what's going on. But
Mhm.
like, yeah, it's good theories at least.
Mhm.
From the with the junior straw, are you targeting that child that has already had a diagnosis of sleep apnea, or are you looking at it more from a proactive, preventative way?
Yeah, so we're proactive preventative and we're a wellness device, so really
Yeah.
it's about like exercising and we're doing studies with like Mayo Clinic for obstructive sleep apnea, so that's kind of like our study is just wrapping up. We've got two participants left, so this is like our first feasibility study for obstructive sleep apnea, and then
Wow.
we'll be doing like a much larger study after that as so that's kind of some exciting stuff. But yeah, for kids it's really just trying to get they're in their growth years and there's just a good opportunity overall like our diets, we're eating like softer food diets, our mouths aren't growing as much, like our jaw structures aren't developed as much, so just doing things that can either improve tongue posture, improve like strength, you're going to have like more oral development. Like it doesn't really make sense like why as a society we have to have like wisdom teeth taken out, like if you think about some of these things like they don't make sense, or why do we have such crooked teeth,
Mhm.
like
Mhm.
it doesn't really make sense if you think about it. So it's
Right.
kind of like how can you do things that are simple and preventative? It's like working out, like it's kind of, and getting exercise and trying to be more like our ancestors in a way. So yeah, so
Yes.
more proactive, preventative. But we have people that say their kids are, they're sleeping with their mouth closed for the first time, or they're sleeping better, or sleeping through the night. My favorite's this young girl with Down syndrome who for 10 years her mom had to sleep. She has a CPAP, but she would always rip it off in the middle of the night. And for 10 years her mom would have to sleep with her to hold on the mask. And for
Oh,
the first time, so she used Remplenish for 6 months. And for the first time in 10 years, like she didn't have to, she wasn't ripping off the mask at night. So
Wow.
it's
Mhm.
like a
that's the
huge,
reward.
Yeah.
Yes.
Increase her compliance to ability to comply with the CPAP, which is what we hear a lot with myofunctional therapy, even to not replace the CPAP, but to allow them to be able to tolerate it.
yep. Yeah. So there's all sorts of like, and I think it's not an either or. It's like, it depends on everyone's condition. Like if you can get down to zero and normal, like awesome. But a lot of it, you can just combining different therapies, like,
Yeah.
and there's people that are on CPAP who have, residual apneas. Like they're still having apnea events. Like, well, why not you include something else in to help that? It's kind of these daytime therapies mixing it with what's happening at night. Or ultimately, hopefully, we can get to a point where we don't need nighttime therapies. But that's like a way down. I think there's a lot more to be done before like that kind of stuff. But obviously, CPAP's like a great solution,
Right.
So, but if we can prevent, obstructive sleep apnea from developing at all, like I think
Mhm.
that's the ultimate goal of
Mhm.
everybody, in the medical field.
Absolutely.
Definitely.
Yeah.
And I feel like I feel like you're finally in the last 5 to 7 years, I feel like I always use that as my guide, that you're starting to hear more about being proactive in looking for sleep apnea
Mm.
and looking at airway and airway health, and even looking at like even the tethered oral tissues and their effect
Yep. Yep.
on airway, because there was, prior to that time, it was, well, it's not a significant sleep apnea, so it's only mild. And I don't remember who off the top of my head, but there's someone that always says no, sleep apnea is there's no such thing as mild sleep apnea. If you have sleep apnea, it's sleep apnea.
Yep.
Right. The person that created that scale wishes he never did, because mild sleep apnea could have significant complications to an individual.
Well, yeah, you're pretty much suffocating at night and
Mhm.
waking up because you're not getting enough oxygen, and
Right.
it's causes stress, like stress hormones like building up, and
Mhm.
you're just not getting good sleep. It's like the
Mhm.
quality of sleep, and yeah, it's just something I think everyone wants to breathe better, sleep better, live
Live
their best
better.
lives.
Yeah.
So,
Definitely. I think it's interesting how we're both Remplenish, the Myo nozzle straw, and Spot Pal. Sometimes the audience or the consumer doesn't understand always that what you do during the day can impact what happens at nighttime. So both our appliances, are like that we're able to train the tongue during the day, which will carry over into sleep.
yeah, it's really trying to build like habits, and for us, like, yeah, because people don't really know a lot about this, like, we're kind of, how we think of ourselves as kind of we call it the tip of the spear for like airway health. Like, really what we're trying to do is spread awareness, education, and empowerment, because
Mhm.
most people don't realize they have these issues, or there's things you can do about them. Like, if you ask people, what's your correct like swallowing, or what's your like anything, like they'd be like, I didn't even know that's the thing I should be thinking about,
Yeah.
like,
Yep.
or even like
Hear
where your
that a
tongue.
lot.
Yeah,
Yep.
right. And we're like, where's your tongue right now? They're like, I don't know, in my mouth.
But but it's really about like spreading, the awareness to the public, and the healthcare professionals as well, because it's kind of it's on both sides. But that's where what we're excited about is because we're also going after snoring. Like, it's such a prevalent condition, like a third of US adult snore. So it's
Mhm.
like a way to, here, this is like myofunctional therapy. Here's, stuff you should know about to help either yourself or your family or your kids. It's really, how can we drive that awareness and spread the movement, like it's kind of this whole thing. And
Mhm.
yeah, so I think just kind of more education, more awareness, and more opportunities to do that,
Mhm.
like how to, I think there needs to be more people talking about this outside of, you have the very like everyone who's like in the airway health movement is very passionate, usually from, maybe they have their own story or their kid's story. But then, like, what about all the people that, don't know this is going on, or they could benefit, or their kids could benefit, so it's really, how do we get more of it out there and change how practice is done? So,
Mhm.
And
yeah.
that's ultimately why we even play these in our waiting rooms, because we see close to 3,000 kids a week. So if for every child, there's a parent. So
Mhm.
even if they're learning a little bit more, whether it be to help themselves or to help their child, it's, spreading that message and getting that message out there.
Yeah, I love that. I think more practices should do that. That's sweet.
Yeah.
Mhm. Mhm.
I think educationally, unless you're really looking for something, and just like you had said, we'll hear all the time, like, I don't understand why myofunctional therapy helps with picky eating, and I don't understand why myofunctional therapy needs to be done when a child has an articulation issue. And it's a lot of education, and it's taken a long time to get that education out there. And don't get me wrong, it still needs to happen, but I feel like it's definitely appreciated more and more.
Mhm.
And now, like, on the Spa Pal path, I feel like we're at that education part. Like, we're starting again with education, and getting away from, we're trying to um, recreate something. We're really just trying to help, and to manifest whatever they're doing in a positive way. more
Mm.
often so that we can make positive change.
Mhm.
We're not trying to take the place of something else.
Mhm.
And I do think that's often misunderstood or their perception of it is just different. They thinking that we're trying to change something that we're not. We're just trying to address something that's already out there.
Mhm. Mhm.
Yep, yep. Yeah, I think just getting people, well, one, to know that they have the issues that they have, and then two, like, what can they do about it? And then doing it in like a good way. Like, so one thing is what we're trying to do more of, because we get a lot of people who are coming maybe for the snoring. They're like, yeah, my kid's snoring or I'm snoring, and this is why I'm going to use this product. And then they use it, and then trying on the back end, like, how do we give them the education or the resources, like where to point them to? Because our product's great for like, the tongue elevation. It's great for like toning the muscles, but there might be more things going on. Or maybe they need specialized help, whether they have a tongue restriction or if they have, other issues that they have to address, like other compensations,
Mhm.
so it's like, how do you point them in the right direction? That's something we're always working on, like,
Mhm.
having, and we have resources on our websites and our post-purchase emails, like here's things you can look for, or places you can go. And that's actually something we're working on, like a whole new website to try to have more of this stuff like
Yeah.
available. And
Yeah.
here's the healthcare professionals you can, go see, all that kind of stuff. So there's a lot of stuff we're doing like on the back end of like, trying, it's a work in progress right now,
Yeah.
but
It's
a lot of
always
changes
a
in
work. It's
2025.
all
Yeah.
work in progress, right?
We're in that journey with you because
Yes.
we do the same thing. As much as we are a product that can be used in therapy, we are direct to consumer. So some people just find Spot Pal and they're not in therapy. And that's always been really important to us too, is that let's guide them because maybe when they see a little bit of benefit from Spot Pal, they'll be able to realize like, hey, I want more. I want even more benefits. Let me look more into myofunctional therapy or, whatever that may be for them.
Yeah. So I'm sure there's opportunities on collaboration there too. So.
Yes.
Oh, agreed, agreed. That was a great little segue, Toni-Ann. I love it. I have one last question for
Yeah.
you. And is there, when you're talking to a consumer, is there a time frame where they would expect to see a difference? And then is
Mhm.
it forever? Like, are they utilizing this forever?
Yeah. So there's kind of, it depends on the person because we've seen people that get results really quickly. And we're still trying to figure out if it's because of like tongue posture or, maybe it's just the neuromuscular responsiveness really quick, but it's within a week. So like some people they're like, or maybe it's the tongue posture and nasal breathing at night.
Mhm.
But yeah, it's within a week for some people, but we kind of tell people to expect around a month, 2 months, 3 months. It's kind of like think of like strength training. Like you're not going to get all the benefits right away. It takes time to build up. So, usually a month, you start to see results, 2 months, 3 months, all the way up to like maybe 6 months. At some point, it's going to level off, and that curve we need to study more. But I'm sure it's different for each person depending on where you start.
Mhm.
But yeah, that's kind of the two groups because some are crazy and they come back and they're like, yeah, I'm sleeping so much better. I used to wake up. So that one, I think is awesome, but we need to understand like those people more because
Mhm.
so we can target them more, I guess, because they're
Yeah.
the ones that get the most benefit right away. But then
Right.
for like using it, it's also from at least the habits that are changed. So, if you are, often if you're going to do stuff with like swallowing, working with like a myofunctional therapist, speech language pathologist, you're going to get that good pattern developed. And then using our product in combination, so you have that, make sure you have it well established because then that habit's going to carry on for a long period of time. The part that's going to like degrade is the actual like tone or strength. And that's like if you think of our ancestors, we're chewing a lot more, we're using our mouth muscles a lot more than we do today. So if you think of that part, like there is, if you stop using, stop working out, stop doing myofunctional therapy, there's going to be like a strength, your muscle tone's going to decline a little bit, So we've seen like usually it's within like after a week or so of stopped use, like maybe some of the symptoms will start coming back. But then if you just use the product again, it'll go away. So we've had some people they're like, yeah, I use it for snoring, and then I stopped using it. Then my wife started being like, hey, keep using it, like so there's some
Yep.
aspects of that. So it depends what you're using it for though. If
Mhm.
you're using it for myofunctional benefits of like non-strength, non like snoring or whatever, then yeah, that,
Mhm.
the habits will last longer, but then the toning, the muscle strength, that's something that'll decline, just like working out. So it's good
That
to,
makes sense. Mhm.
work out or have a maintenance, maybe you don't have to use it as often. Maybe just use it like a couple times a week or, whatever it is, or use it every day. Like it is pretty easy. It just depends on, how much burden it is for you. But we have made it as easy as possible to get your therapy. So yeah.
That's
That's
awesome.
awesome.
Mhm,
No, it
mhm.
really is. We've been, I will say we were pessimistic when we first we're like, okay, well, who's the straw and what does it do? And then after you utilize it and you feel what it's working, and it's hard not to say this is I don't know why not every straw is like this. That's
Mhm.
why I even brought up like the
Yep.
baby bottle and,
Mhm.
sports bottles and, every straw that is out there, especially from a pediatric side. Why not start this sooner?
Mhm.
Because if we can work those muscles from infancy, then hopefully we won't have a lot of these issues. Although you may put the myofunctional therapist out of business, and that may be a whole other issue. But no, I mean, it really can carry over into so many different areas.
Well, and really what it is, it's for one aspect of the therapy. Like, so I don't think we'll put myofunctional therapists out of business.
I
There's a lot of other
don't know.
things to
Yep.
help with. I think
Yes.
it'll be more like specialized. You can work on the more complicated things of where we can focus on the tongue elevation. But yeah, I agree. It should be every drinking device for sure. And we've got some work to do.
Yeah. Absolutely.
Quite the
Absolutely.
challenge.
It is. But at least you know where your target is. You know your target audience. You know exactly where you need to go next.
Yep.
And I look forward to the benefits of it as well. So
Mhm,
we use it in our house. So we got
Yeah.
mhm.
the whole family's using a Remplenish straw. So it's
Yes.
good.
Yep. That's
You've turned a few heads on this side, that's for sure.
That's awesome. Yeah, we've got like all of us, all our team. Yeah, we use it all too. So, yep.
That's
And
awesome. Yeah.
and definitely, we've got some, and I'm sure I don't know like when this will be aired or not,
Mhm.
but if anyone's wondering about the stainless steel bottle, so we had stainless steel bottle. It just flew out on Black Friday. Like I mean, like it just ran out on Black Friday. So crazy time, but like early in 2025, we'll be getting more product again. But yeah,
Oh.
definitely the stainless steel. People, it's not real unless it's stainless steel. So
Apparently, yeah, I like it.
People
I
say
like it.
that.
Yep, exactly right. No, I'm glad that you just said that
Mhm,
because
mhm.
I feel like that would be,
Yeah.
yeah, a
And
question.
those that don't know, it can be the water bottle, it could be just a straw. So if you have a water bottle you know and love, you can just add the straw to that, or they sell the water bottle and straw as a combination.
Yep, and we have the straws on
Speech
our
store.
store. Yep, our
Yeah.
speech store,
Yeah.
so it's easily accessible to the patients and the people near us.
Hmm.
So,
Yeah.
well, thank you so, so much for joining us and for taking the time to do this. And I know it was educational for me, so I can only imagine that to be educational for everyone that has the ability to watch it.
Hmm.
So I really thank you a lot.
Yes. Thank you.
so so I've got a question for you.
Oh,
Like,
Uh-oh. All
so,
right, wait, the tables are turned. I'm ready.
yeah, so I think I've kind of heard this at like one of your presentations, but what got you on the journey of Spot Pal? Maybe I don't know if
Ooh,
I'm supposed to be
oh,
on the
wait a
podcast
minute. Maybe
asking you guys stuff,
you need
but
your own podcast. Answers with Anders. I don't know. I just named it for you. I think so much of our journey started during COVID when we were doing everything virtually and had no idea what was really happening in the mouth because we couldn't see it.
yeah,
And for years, when you're working with a child in therapy or a patient in therapy, so much of what happens at home is what is going to make the long-term difference. We always say like the hour a week they're in therapy is really just to like review and introduce. So it became how can we make sure that what is being done in therapy is effectively being done at home, and in the proper way. And after seeing so many limitations with appliances that had already been on the market, it just kind of all came to be. And we worked so hard to find like a passive way, which it's so funny because we always would say straw drinking is like a great passive way to work on the muscles of the mouth. But trying to find a way that we could passively address some of these individuals' issues without making it feel like they're in therapy,
Yep, yep.
which I imagine is pretty similar to even what some of the journey you've been on as well, like wanting that same benefit.
Yep. Yeah, for sure.
Mm-hmm.
And so then I don't know, and I don't know how much, like you want to talk about. We can always talk like later about some of this stuff too.
No, it's
Um,
fine. Perfect.
but yeah, and maybe I'm just like, because I haven't talked as much about the journey. I'm always excited to hear about like how, things got started and like how, what you've done to grow. But we can always, I don't know if we can talk about
Yeah.
on the
Well,
podcast or later.
we kept it within the practice for 2 years. So we didn't launch it to the public until 2023. So we kept it 2 years just within our practice in New York. Which is 9 offices. So we did have a large pool of, patients to watch this on. We made a lot of the variations that way because similar to how you did the junior nozzle, we were like, okay, well, we really want to get to the 2, 3, 4 year olds. Like, how can we do that?
Yep.
And that's where the mini came about so that we could have the caregiver handle that acts as extra tactile for lip closure. And we just kept kind of advancing there. And then 2023, we went pretty hard. Lots of conferences. That was like our
Yep.
first thing. We wanted to get to the professionals. We wanted to get to the people who would understand why this product could make a difference for their patients. And then, we keep moving along.
Yeah, keep moving, taking this journey. And we're as I'm sure you are, we're learning so much about the needs of the public and
Yep.
what is involved with utilizing an appliance. I mean, I've never, after being a therapist and representing a treatment, it's so different to switch to represent a product
Mhm.
too.
Mhm.
So it really has required us to change our mindset of like what we're expecting. But we definitely did not expect it to be as well received. We really thought it would be something used within the Myo community. And it wasn't until, which Melissa Mugno
Mhm.
had approached us and said, you can't think of it that way. You really should be thinking about it from the perspective of the 90% of the population that doesn't have access to myofunctional
Yep.
therapy, and working to at least treat, even if it's one symptom that they're having, or to just improve their airway. Something is better than nothing. And that was like very eye-opening because that's exactly right. There's
Mhm.
not everyone is going to be compliant with exercise, not everyone's going to be compliant with therapy, not everyone's compliant with their CPAP,
Mhm.
so it's
Mhm.
how can we work towards improving just one area.
Mhm.
And
Mhm.
airway and opening up the airway was obviously the one that would have the biggest effect on the population.
Mhm. Yeah.
Yeah, it's all about the gateway, open up.
Yes.
Yes.
Either they get some benefit or hopefully, and maybe it's the gateway to other things being
Mhm.
addressed. So yeah,
Absolutely.
but totally agree. Like not everyone's going into, like I wish everyone was, getting myofunctional therapy support, but like unfortunately, not everyone can access it or maybe the cost is a barrier.
Mhm.
But yeah, definitely helping as many people as we can for sure.
Mhm.
Yep.
Um,
And finding the right demographic, finding the right audience that even if they don't understand, they're willing to understand or wanting to understand
Mhm.
what the point is, and not just turning themselves off to something just because it's new and not what they're used to using.
Mhm.
Yeah, no, for sure. It's all about the education and yeah.
Well, it's funny. I used to put paper clips on my patients' straws to make them work harder, and I'm like, look at this. This is so much better. Like squeezing it.
So,
I'm like, you gotta put your tongue in this position.
yeah.
So no, this is amazing.
Mhm.
And yes, definitely we should. I know Amanda's been talking behind the scenes with some of the people on your team about doing some collaborations in 2025. And I definitely think exploring or expanding this conversation, I feel like would be beneficial for us as well, just to hear a little bit about where that journey or some of the doors you may have already found to be that you were able to open that we may be banging our heads up against. So we would
And,
definitely interested in that.
and vice versa, like for sure, because we kind of came. So ours, like when we launched our product, so we came from like first start out as just biomedical engineers or like, here, we've got this product that can help. Like we talked with some SLPs and myofunctional therapists and like airway centric like dentists, and they're like, yeah, we just wish we could give something to people so they could go home with it and use it. So a year later, we're like, yeah, we've got it, and that's when we launched our product.
Right.
And then, but we had no idea what we are doing on like the sales and marketing side. And it was all a bunch of learning, for us. And kind of like it took off in the myofunctional community just because people started sharing about it. Dr. Zaghi got it. He tried it. He gave the thumbs up. And then it kind of just like exploded. We're kind of just like following, because we're like, okay, like we have to, this is where we're getting a lot of like traction. And that's kind of how we got into like the myofunctional therapy community. But it's
Mhm.
funny because like we actually developed it with like with SLPs as well, but just
Right.
exploded in the myofunctional community. And now we're like going into the SLP community and they're like, I don't know, there's this clash with like myofunctional and like SLPs, but it's funny because we developed it with SLPs
Yep.
and it's like we're a part of this clash even though we're not, like I don't know, it's kind of some funny
Oh,
like
yep. It is. You are in the world, the power struggle. Definitely. And you know what? I would say, not that I realized or thought, but now, and I think the speech community or the speech pathology community is a great source of individuals to explore and to introduce, all of these products to. We focus so much on like the dentists, the orthodontists, the myofunctional therapist, airway specialists. And it's interesting from we went to ASHA. We just got back last week. And there was so many people there from all over the world who have access to even less than probably the majority of the people we think of,
Mhm.
and how receptive they were to having something that they can utilize independent of having access to, whether it be therapy or therapy tools, and I would imagine the same thing would be with Remplenish, because I feel like the same approach, like I can invest in this and start to see a difference.
Mhm.
It was very eye-opening. But I think also being that they see their patients more regularly and for a longer period of time, they're really able to see change. Whereas depending on the type of myofunctional therapy you practice or your background, you may not see them for an extended period of time. Whereas speech pathologists, we see them depending on their issues, we'll see them for at least a year, if not more. So we can introduce and then really see if the product's making a difference.
Mhm.
Yeah, no, and I think it's like kind of the protocols too. Like we have lots of like SLPs excited and using it, but then there's others, like developing the correct, how to do it. And a lot of it's like the straw hierarchy is kind of the ours is
Oh
like
yeah.
different than ours is like you thought of as a straw but not a straw, and how does it fit into the straw hierarchy? And yeah, it's kind of
Oh, that's the conversation. That's the next conversation you need to have. Where does that straw fit in? And can you add it to the hierarchy? Where is it here? Is it here? Yeah. Yeah, it's true. And a lot of those up until this point, I mean, I relied on the straw hierarchy as well. And I think it's like the world's changing. Things are evolving. You have people thinking about something like sleep or tongue position on this higher level than maybe it's been thought about in the past. And creating some of these great products to start targeting them.
Mm-hmm.
Yeah, and I think there's a different focus. Like more people are thinking about the airway, they're thinking about sleep. So I think, and it's becoming more multidisciplinary. So I think there's a lot of like cool things happening. Just
Yes.
talking with different healthcare professionals, like the different teams that are working together, trying to give a holistic approach to a patient. So yeah, I think there's a lot of cool things that are like changing, and so I'm very excited.
Yeah.
I think
Yeah.
the future is very bright, and I think we can help a lot of people. And for us, we're trying to help over 1 billion people. So it's like a crazy, crazy amount. But I think that's kind of our mission. So
I love that
we're a little
goal.
crazy.
I love that. You try it and then let me know how it goes.
Oh, we're in process. So we've got a very passionate team, and we're definitely
Yeah, no, I nothing short of perfection, and there's that need. So to be able to set that standard high, I think is important.
Agreed.
Yep. Okay.
All right. Well, we got to spend a little extra time with you, which is fantastic.
So I was getting excited. I wanted to ask you some questions.
Please, and it could be like totally informal.
All right. Well, thank you so much for answering our questions and sharing with our audience about your product and your straw. If you want to just real quick let everybody know where they can find more information if they're interested in learning more about your product.
Yeah, you can go to remasteredsleep.com. So, and also you can follow us on Instagram or Facebook. So just go to Remastered Sleep. So, yeah, and it was a pleasure. I enjoyed being on, and I'm sure there's lots of opportunities for the coming years. So
we look forward to it. We really do.
Absolutely. If you don't see you, have a happy holiday and a healthy new year.
Yes.
yeah,
Thank you.
as well.
Thank you for joining us on this episode of Talk the Talk.
We hope it was enjoyable and educational and further supports you both personally and professionally.
For more information, please check out our REMastered and MYO Minute podcast, as well as our other episodes of Talk the Talk. And don't forget to check out our tongue training appliance, Spot Pal, to help with tongue thrusting, thumb sucking, snoring, TMJ, mouth breathing, and so much more. Visit thespotpal.com.